I'm Dr. Lincoln Parker. This is
Dr. Tyler Hales.
all right, we're going to do a quick video on sleep apnea, but from the patient side, how do I know if I have sleep apnea, or how do I know if someone, a significant other, has sleep apnea? One of the reasons why I brought Dr. Tyler Hales into the office is his expertise in sleep apnea, airway development in kids, and what he can do for people. Tyler, I'm sure you talk to a lot of people that you see the signs of sleep apnea, but they probably have never been told that they have the signs of sleep apnea, nor do they even know that they may be at risk for sleep apnea. So talk to the people, tell the lovely world, how does someone know if they have sleep apnea?
Yeah, sleep apnea is tough, because people come and they're like, well, are you tired? Yeah, I'm always tired. I got 3 kids, and I got a baby, and I got a wife that kicks me in all night. So I'm tired, but that's why. Or I wake up 10 times a night, but just because I drink a lot of water. So a lot of times the signs of sleep apnea go alongside with just your daily life. And so you just chalk it up as, oh, well, that's just life. That's what normalcy is, right? And that's what's hard. I mean, how do you diagnose sleep apnea? Like, it's hard because I can be like, well, do you feel these things? But in your normal life, you're stressed, you're working hard, you're gonna be tired,
right?
Otherwise, you're a king and you're just fed fruits and vegetables.
Right. I mean, I'm never tired. I always get adequate. I'm always well exercised in the morning. That's what they call it, right?
Of course.
I get exercised. Yeah.
Yep. So that's where it comes down to. When you come in, we sit down and we talk very specifically about certain questions, right? Do you snore? That's a big sign. Is there a restriction? Are you getting enough oxygen at night? And snoring is a big factor. People don't think it really is a big deal, but it can lead to more severe problems. So that's really one of the first signs that we look for. Does it mean you have sleep apnea? Not all the time, but it is one of the signs.
Yeah, and can you have sleep apnea without snoring?
Yes. Yeah. So
Tricky.
I don't snore, but I have sleep apnea.
Tough.
So,
yeah. So how did you find out that you had sleep apnea?
So when I was becoming an expert in sleep apnea, they had you take a sleep test to test out the sleep machine.
Yeah.
And I had no symptoms, right? I slept really well. I fall asleep within 5 seconds every night because I'm tired. During the day, I'm pretty good.
Yeah.
So I took a sleep test, and the sleep test told me, yes, you have sleep apnea. That I actually stopped breathing like 200 times at night, which is incredible.
Yeah, that doesn't sound good.
I would have never known that. So really, a sleep test is really how you go about to diagnose sleep apnea.
Yeah.
And those are hard to find. Where you want to go into you have to go into a hospital room and sleep in their bed with all these wires, feel like an alien.
Sounds complicated.
Right?
Yeah.
So I try to make it as easy as possible. We have a sleep test here that you take home, you sleep in your own bed. And that was actually the one I used when I found out I had sleep apnea.
Yeah, and I thought I might have had sleep apnea because my dad has it. He's got it really severely, and I figured, well, I've got some signs and symptoms that are kind of typical of that, and so I took the test home, and it turns out I don't. And so that's just the tricky thing about sleep apnea, right? Is like, well, okay, there's just not a lot of clear cut. Just you have it if you've got this, you don't have it if you have that. And so, coming to see an expert like Dr. Hales, talking through signs and symptoms, or when an expert points things out to you that you didn't realize were there, sounds like getting a sleep test is probably the first sign of figuring out what's really, if there's anything going on.
Oh yeah, for sure. And it's really just, I always tell everyone, you should try and figure it out. Not a lot of doctors really look for that. Right? And people always ask, like, what is a dentist? What do they care about how I sleep? Right? Like, kind of creepy. But it's really, no one's looking for it as much, but it is, there's so much like health benefits to being able to correct that.
Yeah.
Right? If we get you sleeping well and through the night, and you're getting the oxygen and you're getting that deep sleep, there's so much better recovery that your body has, and there's so many more health benefits for that.
Yeah, I remember one of the first patients that we helped discover they had sleep apnea couldn't stop them telling their friends and us how grateful they were, because there was such a profound change in the husband's life, quality of life, day to day, because he was able to sleep better. And he actually came in for a sore jaw. And he's like, my jaw's really sore all the time. I think I had TMJ, which we do a lot of TMJ therapy in the office, so that's what he thought he was coming in for. But it turns out sleep apnea. And yeah, it's I can't remember how many people they've just sent to our office that like, oh yeah, well you discovered he had sleep apnea. I was like, oh gosh, it just keeps coming, because it's so profound when you get that change. It seems like so cool. So how do you know you have sleep apnea? Well, the answer to that question is hard. Right? It's hard to know whether you do or not. And so finding a doctor that can provide a sleep test is the best way. So best of luck to all you all out there. Best of luck. That's a terrible way to end it, right?
Yeah.
let's find a different way.
Hopefully we didn't put you to sleep.
Yeah. Oh, nice. Right. Good. Okay. Thanks for watching. Stay tuned for more. Hopefully you like it. Ask questions of what you would like us to talk about, and hopefully this is beneficial for you. Thanks.